Let's begin with our top focus this hour. Now, in a move that has triggered strong reactions from all quarters, the Karnataka government is planning to introduce a GPS tracking system for government doctors. Now, this comes after reports of doctors carrying out private practice at the time they're supposed to attend patients at government hospitals. Now, Medical Education Minister K. Sudhakar says that they are working out the modalities or some or the other alternative will be found in order to fix this problem. Now, reports suggest that nearly 10 to 15% of government doctors have been doing private practice during their official hours. Now, to get a sense of how feasible this move is and what doctors actually feel about it, I'm being joined by Suresh Neelamangalam, the BJP Karnataka spokesperson, and also Dr. Rajashekar, Secretary, Private Hospitals and Nursing Homes Association in Karnataka. All right. Now, before I open up the floor for a discussion, I want to go across to our reporter Thoya, who has been tracking this story very closely. Thoya, for a very long time, the Karnataka government is troubled by this issue. They have tried a number of ways to make the doctors accountable. But really, what has triggered this kind of a geotagging move by the government?
So, well, Apeksha, absolutely. This Health Minister, Mr. Sudhakar, has given a statement saying that they will be introducing, very soon, they will be introducing geotagging and geofencing for the government doctors here in Karnataka in all the government hospitals, because they have started receiving complaints on the government doctors saying that they're very irregular for their practices in the hospital. Meanwhile, even in the duty hours, the government doctors are going to the private hospitals and they are conducting they are doing their practices in the private hospitals. These kind of complaints that the government have received, that is the main reason the Health Minister Sudhakar has taken a decision, and he's also trying to speak to higher authorities to introduce this geo-tagging and geofencing for all the government doctors. This geofencing works like they're going to fence the entire government hospital, so that even if any government doctor walks out of the hospital in any duty hours, they will get a notification that this doctor has been he's gone out of the hospital. These kind of GPS trackers that the government will be introducing very soon here in Karnataka in all the government hospitals. Back to you, Apeksha.
All right, Thoya, thank you so much for getting us all those details. In fact, also let's listen into a few reactions that we have got through the day from what doctors think about this move.
At the same time, when we see somewhere it's going to infringe on the personal rights of any person, like a doctor. So every time somebody is watching you, what you are doing, and it's not a right thing. But somewhere when there are black sheeps in all the communities, the government wants to ensure proper attendance by them and proper work ethics. It's all moral policing. If the doctors can do on their own, the governments don't need to do it. But they are going to do it. It's a welcome move. Let them do it. I expect all our fraternity to accept the same and cooperate with the government and give their best to the upliftment of the poor patients and improve the medical standards in our state.
Let's bring in our guests tonight, Suresh Neelamangala as well as Dr. Rajashekar. Many thanks, both of you, for joining me tonight. Mr. Neelamangala, to you first. I want to start by understanding what is government's plan. How exactly do you intend on geotagging the doctors?
Okay. So if you see right now, about 10 to 15% of the doctors have been moonlighting and rather been very public about doing moonlighting. Now what happens is, in the past we have introduced biometric attendance and things like that, but still you see there is some kind of irregularity or during the duty hours of the government service we see them that they are not available. So one of the things, very crucial in a government hospital is for the doctors to be highly available because of the huge volume of patients who come in.
Right.
Now, in order to ensure that the doctors are available and are present in the hospital, there is a proposal under discussion to introduce geofencing and GPS tagging. So typically, right, purely from a technology standpoint, it's exactly like your Arogya Setu app, for example, right? If you sort of put where your location is, then it basically sort of understands that you are at a particular location, and once you you're done with your duty hours, or you're done with your work, then obviously you could go to the app and turn off your location. So there is no infringement of privacy, or there is no such policing or anything that happens. It's just that there will be an app or where you'll sort of just enable your location. And this also, again, right, this is just only under discussion right now. There are other ways also to sort of do it, but as of now, this is only under discussion. Also, one more thing, the Karnataka government and the Minister, Dr. Sudhakar himself, he has told there is no ban on private practice or any such thing. The doctors are free. If you look at pan India, there are 20 states which have banned private practice for doctors. But Karnataka is one such state where we have allowed private practice to happen, but not at the cost of the government duty that they need to perform. So this is why we sort of need to take strict measures to ensure that doctors are available during the duty hours. And one more thing, what the government has also proposed, right? See, why doctors go for private practice is to sort of earn more money. So there is something called under the Arogya Setu, under the Karnataka government's health scheme, there is a provision which is being discussed where the doctors, if they opt in to do duty beyond their stipulated hours, there will be a overtime fees, a professional salary that will be paid to the doctors for working overtime. So those considerations are also being discussed right now, wherein it will motivate the doctors to sort of be in the hospital for a longer time, and at the same time, right, they get extra salary in terms of overtime allowances, and thereby it's fully justified for the doctors also to spend more time in the hospital. So
Mr. Neelamangala, if I understand this correctly, you're saying that the government, the doctors will be coming in using their phone. They'll probably punch in their time using, geotagging, and for the amount of time that they are in the hospital, that is the time where you'll actually be using geotagging, correct?
It is all completely location based. So if you see how the technology will be implemented, will it be implemented at all, or there will be a different modality, is still under discussion. However, if you take one example of where this technology was used, it was used during the COVID time. For example, if there is a COVID positive patient, how do you ensure that he doesn't leave his house outside and start traveling around in the road, right? So it is through your mobile phone. So it is through a particular app. It is through a location tracking. So this is purely a technology.
But
so
how will this really help you keeping tabs on doctors who are coming late or who are not coming at all? Because you're saying that the geo-tagging will be limited to the number of hours they're supposed to be in the hospital. They come in, they punch in, they leave, they punch out. So how is this going to help you with those doctors who come in late or who are not turning up at all, which is the primary problem?
So obviously, you know that at 8 a.m. this particular doctor's biometric and the location is not at the hospital, where he is supposed to report for duty. So then there will be a certain traceability, right? There will be a certain digital footprint from which we can, ask, why the person didn't report to duty, for example, and thereby understand, what is causing the doctor to not be on time. So is it some kind of, issue that he is facing, or is it some kind of,
So, but you already
private
have the
practice?
biometrics for that. The biometrics gives you a fair idea of who's come in and who's not come in.
And they are doing
See,
it 3 times
once
now.
I give
Biometrics
it
3
is
times a day.
something. See, the idea here, please understand, is to not sort of create the situation where the location is perennially or permanently tracked. The idea is under discussion where we need to ensure that the doctors are in hospital and not leave the hospital and attend to some private, commitment of theirs somewhere outside.
Okay,
So,
all right. Fair enough.
this is
Dr.
this is the-
Rajashekhar, all right, fair enough. Dr. Rajashekhar, how do you feel about this entire thing that Dr. Neelamangala has spoken about so far?
And Apeksha, see, the intention is to ensure that the patients are benefited. But the way the government is going about, I think, I'm sure government of Karnataka has good wisdom not to implement these things, because this shows immature way of handling a situation. The reason is, if our intention is to help the patients, there are more things to do than address 10 to 15% of doctors who are going out. I'm not defending them. Nobody should go out of the working hours to treat some other patients. It's wrong. They have to be punished.
Right.
Then what are you doing here? You are suspecting all the 85% of other doctors who are doing their service well. Under the Constitution, we are not supposed to track anybody or suspect anybody unless you have proof.
Right.
See, now our worry is, how will the doctors feel about it? Like, if the same thing is told that we are going to track all the officials of Vidhan Sabha, or we are going to say all the officials of some take judiciary or something else, they may be honest and they know they are working well. The moment you say that we are going to track you like this, there is a kind of an emotional element, and there is a lack of trust between the doctors and the government that will come up. And if you take healthcare itself, see, government healthcare has to come a long way. We all agree. But you can't project by giving statements like this to the public that healthcare is poor because of doctors. There are so many things. Infrastructure may not be there, staff may not be sufficient. See, our country is a huge country. If you ask me, is it better today than it was 10 years back or 15 years back? Yes, definitely it is better. And there is scope for improvement. But whenever we make these statements, we'll be causing a lot of collateral damages while trying to correct a small problem. I think the entire wisdom has to come in that. And if you look at the way we are treating doctors in our country, see, doctor is a skilled labor. So to make a doctor, it takes 8 to 10 years of rigorous training.
Absolutely.
And many people, so when they start at 18 years of age, even at 30, 31 years of age, they are on stipend. But they would have married and their children will be there. They'll be borrowing money from their parents. See, when we have to retain the talent and make them work, you need to create a more conducive environments. See, many of the hospitals in Karnataka itself, they don't provide quarters for doctors. In Bangalore, we have huge hospitals. There is no doctor's quarters. There is no facility for their children to go to schools. Like many central government institutions, they provide quarters. They provide, even for meritorious students, the top rankers who take, they don't have a basic hostel facility. See the way we are treating people. And the stipends are very meager, so still they'll have to fund from external resources. And see, we are somewhere missing the road where we are not able to retain the talent, groom the talent, and get the best out of them. Because all these doctors, they love working, especially those who have joined government services. They have a passion for serving the poor. same people, if they resign and come out, they learn equal or more. But there is a reason why they are there. So that is 85% of the people, which Suresh himself was saying. You have to respect that 85% and groom them, and definitely take action against the 15%. But while doing this, we shouldn't miss out the trust, and we shouldn't give a message to the public that we are scapegoating somebody and changing the healthcare. You just cannot change healthcare by geofencing.
Dr. Rajashekar, some very valid points that you're making, and I completely agree with you, which is why I want to ask a follow-up question to Mr. Neelamangala. Sir, we have a doctor on the panel, and you have gotten a first-hand reaction of how the doctors are going to feel. Do you feel that this is an immature way of handling the problem? Like, why punish 85 and 90% of doctors who are actually diligently doing their jobs for the wrongdoing of a few?
No, see, what the government is proposing, even when biometrics was introduced few years ago, instead of doing a signature in a book, that time also similar questions were asked. Why you are introducing biometric? Why you are sort of doing this thing? So what happens is if you look at the magnitude of the day-to-day operations that goes on in a government hospital, be it the Victoria Hospital, be it the Martha's Hospital, there are lakhs of people who come in. You just take Jaideva, right? The cardiology super specialty hospital. So what happens is there will be many doctors, who are sort of employed. There is so many departments and things like that. So what we are saying, even from an administration standpoint, in order to ensure that the doctors are available, right? This is again right now under discussion. It is not like today itself we are going to do it, or tomorrow itself we are going. No, that is not the intention.
Yes.
See, doctors. I know doctors who are doing human service to the society, who are real role models, right? In government service, they're doing a phenomenal job. What is happening is that this private, practice is kind of seeing a very sharp increase in the recent times. If you, especially in the last 6 months to 1 year, post-COVID. We are seeing a lot of doctors, maybe in the past, if there were 2 or 3%, it's sort of increased to 15% now. So the government also is sort of aware of this and looking at ways, and technology is one such way, where it's very simple and also very easy, and it also sort of ensures that the doctors are sort of available on duty, and all this without any sort of hassle of clicking biometric somewhere or doing some signature somewhere, or
Absolutely fair. So, Dr. Rajashekar, just to be fair to the government, let's not deny that this is a genuine problem. Like, the way doctors cannot be made to suffer, similarly, even patients cannot be made to suffer. Government has tried biometric attendance, salaries, they've linked it to punctuality. Doesn't seem like any of that is working. In your opinion, what more can they do?
No. It's actually working. Sometimes the government makes these statements to draw public attention that they are doing a lot to healthcare and all that. But definitely, if they do this, it will be one of the immature kind of way of making it happen. Technology is good. I agree with Suresh. Technology is good. So they can try it out in some offices. Many other government offices are there. So there are many offices where people do not even attend and they do not do the work on time. So a lot of things, like Suresh knows that, and where larger public are involved. But my only issue is, as a government and as a responsible society, we should be handling the medical profession with little more sensitivity than other professions. The reason why I am saying this is, healthcare is essential. It is almost, I will say, like army. Army is at the border, waiting for some probable problems and guarding the country. This army like a medical doctor, like a soldier, he's here trying to attend the health problems. So when we are there, we need that kind of sense of commitment, sense of trust, sense of involvement in the profession. And he should also feel happy that the society cares for him. In democracy, what happens is it's the majority which decides. So doctors can never be in majority. It's less than 0.001%. But it is the sense and sensitivities and the intelligence of the majority in handling this profession that's important. I'll ask Ms. Suresh to seriously look into the kind of students who are opting for medicine. I'll request him to take a survey of plus 12 and plus 11 students, asking them what is their aptitude to join medicine. Many of the talented students do not want to join this profession just because they are not treated well, be it judiciary, be it consumer courts, be it the press. One bad surgery happens after 2 decades of his practice, they'll say it is a botched surgery. They don't get into the other side of the story. 2 decades he would have served and something happens and they'll say botched. And some consumer court case comes, the entire earnings of the person will be gone in one case. Whereas same compensations are not given anywhere else. Here the fee would have paid is 200. It all shows how we are treating this profession. It is not good for the society at large. And just to bring in 15 to 20% of people, this thing. So government knows 101 ways. They can have some squads which check on them and let there be serious punishment, let them suspend a doctor who goes and this thing. And they can tell all the private hospitals not to entertain any government employed doctors between these hours, between these working hours. And they can ask for statistics of the doctor, each doctor, what he has served. Just because the geotag and he's staying in the 4 walls doesn't mean that he'll be serving. So just let them ask for the statistics of the doctor. And in some states, they have hired on as consultants. Even for private government hospitals, they have hired on consultants and pays for as per services they render. Then government will get excellent doctors and definite attendance of doctors, and they can pay. And they should look at hybrid model. So Suresh spoke of Jaideva Hospital. Jaideva Hospital has an excellent hybrid model. You know, the based on the doctors' extra efforts, not only the doctors, even the housekeeping staff, they get paid for their services over and beyond
so
their.
Dr. Rajashekar, I believe what you're trying to say is that the problem is deep-rooted, it's multifaceted, it's not just about geotagging, it's something that the government needs to look at holistically.
Government, public, press, everybody. No, we should treat this profession and professionals with some sensitivity.
Absolutely.
See, it raises sensationalism. And in a majority society, if Ms. Suresh goes and asks the public, what do you say about this? Everybody will raise hands and say, yes, we should do it. Because that's how the majority is run. But you can't run everything like that. There has to be some sensitivity.
Right.
What if tomorrow no talented person joins? See, it requires a lot of dedication and passion and inborn talent also into the medical professional to carry out such systems. Not just anybody comes and anybody, see, ours is a large country, people come and join. That doesn't mean that they're going to be good doctors.
Absolutely.
So we need to
Dr. Rajashekar, you've made some...
And government, will be disrespecting a huge community, especially a community which served. Ours was one of the best states which did COVID management.
Dr. Rajashekar, you're making some incredibly, very important points, and I hope this is something that the state government will consider. Once again, just to remind our viewers, this is something that the government is mulling, it's considering, it's not come into effect right now, but clearly we just wanted to take a check of how the doctors will feel about this. Suresh, Neelamangala, as well as Dr. Rajashekar, both of you, thank you so much for joining me today and sharing your viewpoints.